Hi, my name is John Richards and I'm here to tell you a bit about using your insulin pump whilst you're out cycling. I'm 61 years old, I'm from Louth in Lincolnshire and I started cycling at the age of 14. In the 1960s I raced both as a junior and a first category senior amateur and I had no trouble with my diabetes in those days, but by the age of 39, after falling off in a cyclocross, I found myself with the classic symptoms of diabetes. I was thirsty, I was tired and I was losing weight. Attempts were made to treat me with tablets. Within 4 years I was on insulin and by 2002 was using a pump. Incidentally, if you're still not sure about moving to pump therapy, there are lots of advantages. Better blood glucose control means you feel better. Just doing 2 injections a week instead of 35 is a big plus. And of course you can achieve a lower HbA1c. I then encountered a problem with my heart, atrial fibrillation to be exact, and it seriously curtailed my cycling. 90 minutes or 20 miles was my limit. For these rides I would disconnect my pump without significantly affecting my blood glucose level. An ablation operation in 2006 cured my irregular heartbeat and my need for beta blockers. I found myself able to cycle longer and further, with 3.5 hours or 50 miles being my maximum in 2007. During this time I found I was getting home with blood glucose numbers in the high teens, so clearly I needed to have a pump running on my longer rides, but the question was, at what level? I posted this query on the question and answer section of Cycling News website and got 3 positive replies, all from the USA. As an indirect consequence of this, I made contact with Dr. Gaziz at the Queen's Medical Centre, Nottingham, who in turn told me of the work of Dr. Ian Gallen at Amersham in dealing with diabetics who wish to participate in sport. A consultation with Dr. Gallen, together with dietitian Karen Hume in March this year, has put me on the right track, and it's this knowledge I want to share. Essentially, the basal rate of the pump should be reduced to 20% of normal. Do this when you're getting changed to go out, and reset it after you've got home and showered. I use an Accu-Check D-Tron Plus pump, but I'm assuming that all makes and models have the facility to adjust the basal rate. During your ride, energy levels need to be maintained to prevent a hypo, and are best provided by dextrose tablets together with a sports drink at 6% solution. I use the Power Bar product, but if you're on a tight budget, then basic glucose is a much cheaper substitute. The only way to monitor what is going on in your body is to carry out frequent blood glucose checks. One at the start, followed by a repeat every 30 minutes, and one at the end. If, like me, you've been brought up to accept that all training rides should be non-stop, this comes as a cultural shock. Worse, you can't expect a big group to stop 4 or 5 times on a ride whilst you carry out your checks. So you either have to ride alone or with a few understanding friends. I use the Accu-Check Aviva monitor for my tests, and it fits easily into a jersey pocket along with the tin of strips and the finger pricker. I usually just take 6 or 7 strips for each ride. I've had the experience of dropping the open tin and spilling over 40 strips onto the road. Now if you're a better bike handler than me, then you could do the test on the move. But I wouldn't take the risk myself, and I certainly wouldn't endorse the idea. With practice, each test can be done in 40 seconds, whereas a broken hip will give you 12 weeks of pain and discomfort, as well as stopping you from getting out on the bike. That's okay, 10.1. The next stage is to assess the result of each test, and decide how much carbohydrate you need to take. 30 grams per hour is a good base to work from. But of course, each ride is different depending on intensity, terrain and the weather, so you may need up to twice that. Dextrose is usually sold in small packets, with 14 tablets making 47 grams, so 3 tablets equals 10 grams. I make up 2/3 of a 500ml feeding bottle, that's to say 330ml, of water with 20 grams of the Power Bar powder. This is almost all carbohydrate, so 5 66ml swigs would deliver 4 grams at a time. If I get a blood glucose reading of between 6 and 8, I'll have 3 tablets washed down with a swig of the drink. If it's less than 6, I'll double that, and if it's less than 4, I'll rest for 15 minutes, eating either a couple of fig biscuits or a small banana, as well as my dextrose. Remember, you're testing and reviewing your blood glucose level every 30 minutes. If the reading is between 8 and 10, I'll just swig the drink. If it's 10 to 12, I'll do nothing. But if it's over 12, I would give myself 1 unit of insulin to move it down 2 points. Bear in mind that you've still got your pump connected, and setting a lower basal rate does not stop you from giving yourself a bolus. When you return, review your blood glucose as soon as possible. Providing your blood glucose is at least 7, you should give your body more insulin. You can either move the basal rate from 20% to 200% for an hour, or just reset the basal to normal and deliver a bolus of 1.5 units. I prefer the latter method as it seems easier to me. Keep on monitoring your blood glucose for the rest of the day at 90-minute intervals. 6 hours after the ride finishes, your body draws on glycogen to repair the muscles, and without careful watching, this can lead to a hypo. If you have the Compass software for the Aviva on your computer, you can then produce a graph of your whole day's blood glucose activity, both for yourself and your consultant. Of course, we're all different, so what works for me may not work for you. This method does avoid horrendous hypos out on the road and the after-ride lethargy that comes from high results. It does not get over the problem of stopping, though there is another piece of kit that does, and you may want to consider this. You can obtain, though not on the NHS, a real-time blood glucose monitor, which is attached to you in the same way as the pump. A sensor is inserted under your skin and reads your blood glucose level every 5 minutes. A transmitter is stuck here on your chest next to the sensor, sends the data to a monitor, which must stay within 2 meters of you. The monitor is smaller than a mobile phone, and it fits neatly into your back pocket. This, of course, can easily be read on the move, and comes with software to store all your data. It sounds great, doesn't it? But in my experience there's several drawbacks. The sensor needs to be changed twice a week, and is more intrusive and uncomfortable than the pump needs. The transmitter is about the size of a matchbox, but it does feel uncomfortable after a while. The monitor must remain within 2 meters of the transmitter at all times. If you get up in the night for a pee and forget to take the monitor with you, then you'll lose the signal and have to run through a setup procedure which takes several minutes. Finally, the equipment costs around £1,500 to buy, and the sensors cost £40 each. So being fully committed to this system will cost you £80 a week, in addition to the capital cost. I did a 3-day trial with the kit, and for me it was not worth pursuing the idea. Perhaps in a year or two's time, when the hardware is both smaller and cheaper, I'll try it again. In the meantime, I'm hoping that as I become more experienced in monitoring, I can reduce the number of tests I have to do at the roadside. Next month, I'll try 40-minute intervals and gradually extend the gap if possible. 2 tests out on the road during a 3-hour ride would be a big gain for me. Finally, if there are any questions that you've got from what you've learnt so far, please email me at the RunSuite website and I'll do my best to answer them.